This series of 5 talks will take you through the process of developing a research proposal. Research in emergency medicine is active and alive in Trinidad and Tobago. However, it's mostly focused around our DM students, and we would very much like other people to get involved, including other doctors, our nurses, and our pre-hospital staff. At the end of the 5 talks, we would like you to be able to identify a question or problem appropriate for research, formulate what we call a PICO question, we'll go into that in this lecture, develop the background for the research question, formulate an appropriate methodology, select suitable statistical methods, and at least identify and consider the ethical issues impacting on your research. So, let's think about a suitable research topic. What you can do is pause the video at this point and think about what the characteristics of a suitable research topic or question would be. Okay, so let's walk our way through this. Research needs to be relevant, and relevant not only to the specialty that we represent, but also relevant to the local setting. It doesn't make sense to be doing research on things that have no bearing on you or the people around you. Whatever we're looking at has to be measurable. The kind of research we usually engage in is objective, quantitative research, and therefore whatever we're looking at, we need to measure it so that we could compare different things through that measurement. For example, if we're looking at research into high blood pressure, we need to be able to measure our subject's blood pressure before and after different types of treatment are given. We need to think about the impact of the research on our practice. The best research should have some significant impact on the way we practice emergency medicine. Think about whether it's necessary at all. Sometimes there are really interesting questions that you want answered, but it's not necessary to answer the question because normal standard practice has already given us an answer, or other people have done the research and their findings are applicable to our setting. Now, sometimes you have research questions that are necessary to be answered in your setting, because just because this research has been done, for example, in North America, doesn't mean that the findings in the North American study would be applicable to Trinidad and Tobago. You really need to think hard about whether you can do this research. Sometimes research is just beyond our capability because of the resources we have, the size of our population, or the type of cooperation we may or may not get from the people around us, for example, study subjects. And finally, can it be completed in a timely fashion? It doesn't make sense starting research and then 10 years later you're still at it and you can't come to a conclusion. So let's think about a scenario. You've noticed that patients who present to the emergency department after a deliberate overdose of medication are always assessed in terms of their risk for self-harm. You may be wondering how many of these patients are actually assessed before discharge from the ED as more of an observational study, or you're wondering if a screening tool such as the SAD person score can help to predict whether these people are safe for discharge. And this is an interventional study. You're going to apply an intervention and observe its effect. So the first step in doing research is developing this idea into what we call a PICO question. A PICO question structures the question in a way that allows us to pick out key components of the question that we will be using to construct our research. So PICO stands for the population that you're going to invest, the intervention that you're assessing, the comparator, and the outcome of interest. And that works for interventional studies. For observational studies, we may just be looking at the population, the exposure or the event or illness that we're investigating, and again, the outcome of interest. So let's look back at these two things, and for each of them, you need to pause the video, and for each of them, try to think about an appropriate PICO or PEO question that would suit these two. So if we're just looking at how many people are being assessed, then that would be a PEO question. It's an observational study. And we might ask ourselves what proportion of patients presenting after a deliberate overdose of medication are assessed for the risk of complete self-harm, of repeat self-harm. For an interventional study, we may be asking ourselves, is the use of the sad person score, that's the intervention, more sensitive and specific at identifying patients at risk for repeat self-harm than routine clinical assessment by the attending EM physician in patients who present to the ED with deliberate overdose of medication? And as you can see, the PICO doesn't have to go in that order, but each of the elements is there in the question. Once we've designed our PICO question, we think about our research objectives. And there's always a primary objective, and then there may be secondary objectives. And what these are, they are statements of intent or action statements that take the question and turn it into what we intend to do. The primary question would be the main goal that we expect to achieve, and that should stem directly from our research question. Whereas the secondary objectives might be other things that we can answer, either related to some information we'd like to get before we answer our main question, maybe about the makeup of the population, maybe about the way a certain disease presents in a certain setting, and then other achievable goals. So we've answered our primary question, for example, with the whether we assess people for self-harm or not, and then we might ask ourselves, well, is it that we don't assess women as much as men? Maybe is it that we don't assess older people as much as younger people? And those would be secondary objectives. So let's go to another scenario. You have noticed that patients who present to the ED after a deliberate overdose of medication are not always assessed in terms of their risk for self-harm. And you wonder how many patients with our same question. Let's see if we can develop some primary and secondary objectives. You may want to pause here, think about it, and then proceed. So let's look at the PEO question, the proportion of patients presenting after deliberate self-harm that are assessed. Your primary objective would be to determine the proportion of patients presenting to the ED after deliberate overdose of medication that are assessed for the risk of repeat self-harm. So that is your action statement stemming directly from your question. The secondary objective may be to determine the age and sex distribution of these patients or identify demographic factors associated with decreased likelihood of risk assessment. Let's look at your PICO question, the assessment of the sad person score. So your primary objective again stems directly from the research question, and it would be to determine the sensitivity and specificity of the sad person score in identifying patients at risk of repeat self-harm. The secondary objective may be to determine whether the diagnostic accuracy of sad person differs when applied to patients of different age groups, for example. So if you have any questions about this lecture, you can post them on our WhatsApp chat or on the questions board on the website. As you work through this lecture series, we have a worksheet that goes with it, and the first section of this worksheet is about identifying an issue that needs to be researched and thinking about what the knowledge gap is, making up a PICO question, and then your primary and secondary research objectives.